Okay, hi everyone. I think I will start the seminar as people arrive. I know that around 50 people have booked to arrive in this session, so I suppose we should make a start slowly. Thank you all for joining me today. This is the last of the seminars, in the series Communicating Data Health, Health Data, Public Health Data creatively during the pandemic. Okay, and today we're also launching the Art Data Health film, Human Planet Weaker Other. I'm joined by Caroline Beavon, who has been the data viz wizard and animator for the film, and we'll have a Q&A after we show the film. So in this series, I've had the privilege of hosting quite a few very interesting speakers, some of them academics, some of them artists or creative practitioners in other ways. We started with the bioartist Anna Dimitriou, who talked about creating meaning from healthcare data through art. And she's also one of the commissioned artists of the project. She created the work Shielding, an art installation that represents the rise of domestic abuse cases during the pandemic in collaboration with a domestic abuse charity here in Brighton and Hove, RISE. We also had Professor Rahul Bhargava from the Northeastern University in Boston, who talked about embodied representations of data, and his work was quite interesting because he talked about data-based dance, which was quite interesting. Marie or Yoongyung Kim, based at the Queensland University of Technology, talked to us about her exploration in data art. So exploring data as an artistic material and medium. I also was very glad to host Professor Sally White, who is also here today, as far as I can see, from Maastricht University and her colleagues in Canada. And she talked to us about their recording of touching experiences during the pandemic, a very interesting talk as well. We also hosted the team from the Storylab project. I can see that Megan and Marcus have also joined us today. I'm really glad to see you here. The team is based at Anglia Ruskin University, and they showed their magnificent film and also talked about their project of representing creatively emotions through the voices of healthcare practitioners during the COVID-19 crisis. So I'll say a few words before we show the film about what in the project we've meant by health data. So health data can mean a few things. It can mean the data that are being collected by GP practitioners, data that have to do with our health, and sometimes they're written notes. So they could be numerical, but they are also, in many cases, forms of qualitative data about emotions or, other expressions of well-being or illness. We also talked in the project about national statistics that are collected via the census records or other means of collecting national statistics. But we also dealt with data that individuals collect themselves using mobile phones or other devices and apps, for example, tracking fitness or diet. And particularly in the Art Data Health project, we were interested in the data collected by third sector organizations and community organizations, specifically around service users, but also their own activity, the activity of a charity organization, for example. And these are data that these organizations are using to report back, especially when it comes to funding. And it's quite important to understand how these data are being used. So we've put together all the information about what health and well-being data may mean and how they're being approached perhaps differently, sometimes by different sectors, You can find this online at the Our Data Health project website. The one I'm talking about is called Understanding Health and Wellbeing Data. Now, for me, the interest in data for this project was specifically to think about whose data are being represented, whose voices are being heard, whose voices are perhaps not being heard loudly in the public domain, and what gets to count as knowledge. Another key question, was how we can challenge the stories that are being told, for example, stories that are being told in the media, and how we can challenge the way that these stories are being told and the data that are being represented and who is not being represented. So underrepresentation of certain social groups and certain communities, but also the use of design, good or very bad use of design, and in many cases. And we try to engage community organizations in the research design and the data analysis. Of course, this has not been always possible, especially once the pandemic struck. So in many instances, we had to change our approach to research design and to try to develop methods to capture the rich social data that we need in order to address complex social issues, such as the issue of health inequalities. Another aim for the project was to understand stigma, and specifically for the project, I ended up working with communities, and especially for this film, with people who are based in East Brighton, a more impoverished area. So both communities that are facing stigma because of how they are perceived by the rest of society, but also because of their geographical location. Another aim, of course, has been to motivate audiences to understand these collective themes through individual narrative and highlighting and giving space to this individual narrative. Now, there's been quite a few inspirations for the project and for the film, and quite a few, historical approaches and canonical approaches to data visualization in public health. One example here that many of you, I'm sure, have come across is the work of Florence Nightingale. What you can see there is a very beautiful iconography, I suppose, a diagram of the causes of mortality. This dates back to 1859, where she represents causes of mortality in the army. Now, Florence Nightingale was a researcher, but she was also a public health practitioner. And at the time of her work, we saw a rise in the importance of the social sciences, and specifically in something that philosophically, is a concept philosophically that we know as positivism. So the understanding that we can find evidence, numerical evidence, rational and logical evidence through mathematical work for everything that we observe in the world. And this kind of evidence started to be considered as more important and more valid at the time. Now, during the same time, the work of his cartography, John Snow's cartography, specifically around the mapping of the cholera outbreak in Soho in London, where what you can see here uses dots, but his original maps used bars to represent the number of deaths per household. And this kind of mapping helped him to actually come up with a hypothesis about the reasons behind the outbreak. Now, this particular map that you see here has been redrawn, and these maps have been redrawn by many illustrators and have been used in books in the 1960s, even in cartography groups, although John Snow's, many of his maps were not actually used in epidemiology books because they contained quite a few errors. However, he is considered a pioneer. A recent article, well, not so recent, from 2013, an article in The Guardian names John Snow as a pioneer in data journalism, which is quite interesting. Now, one of the previous speakers, Rahul, also brought to our attention the work of W.E.B. Du Bois, who produced these really beautiful infographics, you can call them, of the work and the contribution of slaves for the United States, former slaves. It was also quite interesting to think about power relations and using the language of power, using the language of evidence and statistics for issues of social justice. Now, in public health, we do see the use of data visualization to explain statistical techniques, data mining, and things like that. We do also see data visualization being used to communicate health risks. And we know that this is quite, from research, we know that this is quite a good way of representing public health issues, both for the understanding of doctors and patients, for the comprehension of the complexity of a health issue, of a public health issue. It's also an important way to communicate these kinds of issues to people with low numeracy skills. Now, a more recent example of public health communication comes from the Institute for Health Metrics and Evaluation. This particular one was produced by the School of Medicine in the University of Washington in collaboration with United States hospital systems and other governmental organizations in the States. It does show a projection of the virus. It is interactive. You can find it online and you can look at global, but also according to country. And it is quite interesting how it actually is an accurate projection, if you think about it. There is this approach in data visualization public health where you have like showing the numbers, showing a picture at the same time. So you would ask, why do we need more creativity? And this is one of what I'm showing you here is one of the inspirations of the project as well. It's the work of Susie Freeman, but also in collaboration with Liz Lee. This particular one is called Veil of Tears. Their work, Pharmacopoeia, was commissioned by the Wellcome Trust back in 2006. This particular work shows, I'm sorry that all our faces are on top of the actual work there. But this particular installation shows the effects of malaria in a child's life in the first 5 years of their lives. And it combined academic research with observations and interviews that the artists conducted in Kenya. And of course, the work of Pharmacopoeia is quite rich. This is another example. This one is called What Once Was Imagined. And these 52 arrows around Susie show the weekly intake for a patient of cardiovascular disease. So it is the prescription of a combination of drugs to be taken daily, including a beta blocker, an anti-hypertensive, a cholesterol-lowering drug, an aspirin to help prolong their life. And their work, their art project engages viewers to reflect on their own practices, on their own medical and pharmacological history. So it invites us to take part in the debate around the role of medicine as an establishment, the role of medical treatments, and the pharmaceutical industry as well, and the ambivalences we may feel about this relationship. Now, a very different type of artwork, which also combines numbers and an art installation, is placed at the Auschwitz at the Auschwitz-Birkenau Memorial and Museum, and it's called Glasses. So this is evidence of crime at the Birkenau. And it's a very strong image, although maybe it doesn't it can't be labeled as data visualization as such. It is a stark image of the number of people who were murdered during the Holocaust. So there is a reason to communicate health data in a creative way, I think, because it's a way of communicating to non-experts. It's a way to communicate and to tell stories that people can connect to. Now, for the Our Data Health project, we already had produced an art installation with the work of Anna. I already had also produced with Caroline the 104 Days Later, a scrollable data story. So the decision to move onto using motion graphics and animation in the medical and public health context was also in line with the limitations posed due to the pandemic, and especially in regards to the participatory research that I hope to do during this project. Now, video, of course, is a very powerful way of communicating. Animation, I think, is a very rich medium, and in combination with data, it can be really powerful. So following on from the scrollable data story, 104 Days Later, that you can also, of course, see at the website. And this is something that Caroline and I thought as a way of bringing the numbers around COVID-19 into life through these first-person testimonies. But it was a quite, I found that it was quite a bleak story that that was told through this, through 104 Days Later. And I wanted to tell a story of hope. So the project, the film project, I think does tell a story of hope. The other issue with 104 Days Later was that we collected testimonies of people who did have very good access to technology, to lots of technology, and they were, you know, digitally literate. They were predominantly well-educated and middle class, and predominantly white. So for the film, I wanted to get other voices on board. So what happened was that in August, just after the first lockdown, we approached people from more vulnerable communities, so people who identified belonging in Black, Asian, minority ethnicity groups, identifying as LGBT or Q, who were shielding, who identified as being older, and I tried to hear their experiences of the pandemic. So the collaboration with Hydrocracker, the theatre company, the immersive theatre company, had to do with the filming. So the crew, they were on the ground and they approached people who didn't have the technical means to record themselves, of course, with social distancing, and they helped them to record their testimonies. And that was, the outreach was done through the Wellsbourne Healthcare GP surgery in East Brighton in White Hawk. So through this process, we managed to collect 15 audiovisual testimonies, 15 videos from people living in Brighton and Hove, and many of them are from White Hawk. So for the film combines these participant stories with public health data and statistics about the impact of the pandemic on education, unemployment, mental health, and other key social issues. For this one, we opted more towards visual metaphors, as you will see, as a way of clarifying complex topics. And we limited data visualization to very key statistics that can help us signpost some patterns or identify some important issues. And the idea is that we can reach larger audiences this way, and that we can tell a visual story through this arrangement of a little bit of data visualization, animation, illustrations, icons, and various different visual elements.
A pandemic is defined as an epidemic occurring over a very wide area, crossing international boundaries and usually affecting a large number of people.
It's been a very frightening time.
Things are very dark and very frightening sometimes.
I play wheelchair basketball, and having to stop doing the one thing you love doing every day of the week takes away who you are.
The pandemic itself only ever comes around once in a lifetime, and it's here now.
Evidence suggests that the likelihood of pandemics has increased over the past century because of increased global travel and integration, urbanisation, changes in land use, and greater exploitation of the natural environment.
I want to speak to community organisers and people who have been involved in the work of protecting their communities from the effect of austerity over the last couple of years.
We're talking about being in lockdown and kids' education suffering because they haven't been able to go to school.
Nothing has really changed in our communities. Things haven't gotten better. Things have gotten worse, in fact.
We need to genuinely start thinking about a universal basic income.
According to data from Public Health England, East Brighton has a much higher rate of social deprivation than the average value for England. Child poverty is worse in this part of Brighton as well. Education is also an issue, with children here getting fewer A star to Cs in their GCSEs. And it reaches the older population too, with more of them living alone. Meanwhile, across Brighton and Hove, people began giving and receiving support as they needed it.
I was never really involved in the community that much, but I started up a food hub that opened my eyes up to the community.
And I've heard people suggest that the COVID-19 crisis has reawakened people to the issues that face them.
It was a sort of unique moment, and it made us all look at society differently and from a different perspective, and look at our roles differently. And I sort of found myself valuing different things.
COVID-19 has created all sorts of funny problems and has illustrated very much life's contradictions, and hopefully has highlighted the kindness, the essential kindness of human beings. And let's hope that that goes on, and that in the end, kindness and consideration for others is what wins through.
Working with this organisation, distributing food to people, the community has come together. It's absolutely been amazing.
So what we need to do now is really dig down and work with people in our communities to make sure that they draw the links between how their communities have come alive in the last few months and how they can go forward, changing their lives in the coming years.
Almost restored my faith in humanity as a whole.
People started caring about each other. Neighbours are contacted by young members from the streets.
It's made us think about a lot about the environment, something we've never paid enough attention to. Not so many cars on the road has seemed to be very beneficial to the wildlife, to the air that we breathe.
Lockdown, it was really quiet and peaceful, and I felt really tranquil.
The air became clearer, the rivers became cleaner. Birds started singing.
When I was crossing the road, the car stopped for me and let me go first. That's what I want to happen.
Let's not wait for those in power to give us information or allow us a cure. We do all the work anyway.
Human planet, weaker, other, protect everything.
Okay, great. Hi, Caroline, and great.
Hello.
I will start with a few questions for you, directly for you.
Of course.
Very privileged, I have to say, to work with you for this film and also for the Scrolly, for the 104 Days Later. It's been a great collaboration. And I wanted you to say a little bit, if you could, about whether or what you learned from working for this film. If there is anything as a practitioner that you came across that you didn't know before.
I mean, both this and the Scrolly Telling project were massive learning curves for me, because I probably should have told you this at the start of the project, that I hadn't created an animation before, and I hadn't created a Scrolly Telling before. So both times I said, yes, I can do that. Let's do it. And we pulled it off both times, and the learning curve for me was incredible. And I think before I started this film, I would never have called myself an illustrator. I was a graphic designer, yes. I designed data visualizations and very sort of traditional graphic design. And I'm an amateur collage maker and an amateur mixed media artist, but illustration was never my thing. But I think throughout this film, we brought in some very, at the start, we were trying to find what the film would look like, and we were trying to find some different elements to it. And we brought in, I think I showed you a little bit of illustration I'd done, and you said I really liked the look, and it was that very, very naive, very childlike kind of pencil, scribbled lines, and we went with it, and actually it became, I never envisaged it would become the look of the whole film, and it did. And I think that for me was a real opportunity to just stretch into an area that I had never even envisaged for me before. And I think it's something that, and also we can talk about this a bit more later on, but I was really interested in how it just made the whole film feel really human, especially after the Scrolly Telling, which was got sort of traditional graphic design, very sort of just solid block colors, and this just felt a lot more organic and a lot more human. So I think for me the big learning was just how to do illustration and how it can be used as a way of communicating data, which I never thought would be in my world.
I'm really glad to hear that. Just to say to everyone who's here, please post your questions in the chat, and we will start addressing them when you're ready. Great. I had another question. Let me look it up, Caroline. The other one was, yes, how did you feel that the film connected with the Scrolly in some way, and how? Because I do see it as a continuation of the Scrolly, but also at the same time as a very different way of telling a story, and also, as a platform to highlight the voices of people we couldn't reach with the Scrolly.
I think so, and I think you made this point earlier that yes, the Scrolly Telling was a limited people that we could speak to, or that we were able to speak to at that moment. I think how I see these two connecting is that the Scrolly Telling very much captured for me those early days of lockdown, when everything was very formal and everything was quite data was being gathered, and we were seeing charts and bar charts, and the daily news briefings had this sort of very traditional data visualization. Where I see this film now as a much more, we're sort of coming out of lockdown. It actually feels really nice that the film is launching at this time when we can almost feel like we can breathe out now, and it feels a lot more human. We can almost take stock and start to think going forward. And I just think this film really captures the humanity side of it that the Scrolly Telling didn't, because the Scrolly Telling was just showing almost a snapshot of that moment of that first lockdown, where everything just stopped, and there wasn't even the opportunity to be soft and fuzzy and human. It was all about just getting through that first lockdown. And I think this film really captures, where we are now, which is this sense of, okay, let's go out and let's get back into the world again.
Yeah, and it's also it took us quite a while to finish this film, whereas the scroll was a little bit bub and produced in a very short time, where we tried to capture the data and represent the data and tell the story. Whereas for the film, we allowed a little bit more, a stretch of a time. I think we started filming in August, and then the film was ready now in April. So we had quite a lot of changes in our lives as well during this time. So you know, another lockdown that was quite different to the first one in the midst of the winter, you know, and so I think this allowed us a different rhythm and different type of reflection. I think we went through a few phases of reflecting on the style, on the story, and whether certain testimonies which parts would be included and in which ways. There is a question from Sally. Hi, Sally. Great to see you here. Sally asks more about the value of using theatre practitioners in engaging with the informants. So just to clarify, the Hydrocracker crew, so there wasn't, the interaction didn't include a theatrical performance, but they had a concept, so they kind of were also filming at the time and recruiting participants for their own film project, which uses British Sign Language. So they were also, they had a particular concept for their film, which is called Before the Flame Goes Out. Their concept was to invite people to reflect on what they want to see coming out of the pandemic, while they were holding a match. So for the duration of the match burning down, they would have to come up with something. So so that really helped to get people to think very carefully about what it is that they wanted to say within this very short time. From these, you know, from these films, obviously we took what was relevant to our film, but I think the fact that the crew was down there and was able to chase people to go into food banks and find people that you wouldn't recruit via Twitter or via social media or via, you know, people who don't go online, people who have other worries about, you know, staying, you know, about eating, basically. You know, this is why people have been going to food banks. So having the crew going out in the community and trying to get people's stories was really, really important at a time when I couldn't be doing that. Did you have, Anna says, hi Anna, did you have any difficulty recruiting participants, or were people generally eager to participate? Yeah, so of course there was a lot of issues with recruitment. Sometimes people would think that they wanted to do it, but then of course life difficulties came in the way and they couldn't do it. And of course there was the issue of whether people could record themselves, or they would need someone to be there and film them. Generally in the Art Data Health project, recruitment has had its ups and downs. So initially for the project and for the artistic workshops that we did in the collaboration with artists and communities, we were working with quite a few community organizations based here in Brighton Hove. So recruitment was not such an issue, but for the film in particular, I think it really helped that Hydrocracker and Wellsbourne provided us with a way into the community. So I had another question for you, Caroline, which was, I don't know, you already mentioned a few things, but I wonder if there were other challenges as well while you were, creating.
Yeah.
There were some difficult, I don't know, considerations about whether to go down this path or another path when yeah, visual.
Yes, I think the as the film started to develop, and as you provided this fascinating script, and you decided which clips we're going to use and which speakers, and you'd sort of really crafted this beautiful story. I think then we started to work out what's it going to look like. And for me, as a graphic designer who has spent years using software, that means that essentially you can create anything you want because you're drawing it all yourself. Then, as I started to use video footage, I realized some of the there were some frustrations and some limitations by what can be done by video footage that has been shot by other people. You know, it was in different formats and different sizes and different. Some people, the phone was portrait and some landscape, and just little things like that then meant that we had this, what I first thought was frustrations, but actually forced us to be really creative and forced us to really think, how can we show these voices? How can we really get the most out of it? Which is why some people are illustrated and some people we actually showed the real video clips. Some people are audio, because actually sometimes just their words themselves, especially the part in the film where it's the river floating and people talking about the environment, actually that worked so beautifully, because what people were saying, you could really feel the words whilst watching this illustration happen. So I think it was it forced me, and it forced you, and it forced Liz, who helped us out with final editing, to get really creative with how we were going to do this, because we wanted to make everyone look and sound the best that they could, and I think we achieved that. So for me, that was the real frustration, but also an exciting challenge to use video footage that that was beautifully varied.
yeah, you've done a brilliant job. There's another question again from Sally, who says, how much of the film is researched through animation? So the practice of making, designing, animating. I think there's a very limited understanding of research generally, especially from within academia. I find that usually we think of research as analysis of quantitative or qualitative data. I do think that this is a research animation film. So research is reaching a better understanding and knowledge about the world, isn't it? So I think that the film, the process of doing the film is a form of research, a form, the practice of making, designing, animating, all of this was research, in a form of research and a form of understanding. It's not just about communicating and trying our best to convey the message that people were saying, but also to put together a story, to try to see how the story that the data tell can contribute to the story that we are trying to tell. So this, it is a complex process. It's not just about representing data. That's why I don't think it's the data visualization necessarily explains what it is that we've tried to do here. I think how you called it, Sally, like, research through the practice of making, designing, animating, perhaps better represents what we've tried to do. That participants' voices came across powerfully, and I think in many cases, Caroline, we had the original footage and decided to, because the idea initially was my idea. I really love a film called Waking Life, so I came to Caroline and said, "Can you do this, please?"
A Hollywood budget, yes, absolutely.
Caroline, can we just rotoscope everybody and do an animation of everybody? But obviously, yeah, we opt for using the voices and using other elements, other visual elements, that, like the maps, for example, which both me and Caroline and I know many other people with a creative background really love, because they are amazing in conveying messages. So Megan asks, can you talk a bit more about how the story developed? Did the animation inform the story, or vice versa? What were some of the more challenging decisions? That's an interesting question. Shall I start with this, and then
absolutely
over for the animation? So the story. So I came to Caroline with a very strict script. So I went through the film footage and kind of identified the key themes that you can also see in the film. So these are to do with community, kindness, coming together, and yeah, how political powers and established politics are failing people, basically. So these were, I think, the four key themes. And then I also had to had a sense of the style of the film. So the story was, I kind of came to Caroline with a clear story, didn't I? But then as the animation started being created, I think that the story slightly changed in some issues sometimes. Catherine, thanks for joining. Yeah, see you soon. Thanks.
Yeah, I think you're absolutely right in that the story develops, and as with any creative project, there are times when you go, actually, either that's not working or it's better here. And I know even down to the final edit, there were sections being moved around. So, you know, I think because, you know, I think at one point the film was like 7 minutes long at one point. I mean, we had to do some quite strict editing, and then it just comes down to, you know, we've got two segments here. Which one is the absolute strongest? They're both brilliant, but which one is the strongest in terms of what the audio and the video that we're using? So yes, some really great bits had to go, but I'm sure every filmmaker will tell you that the cutting room floor is littered with brilliant gems that just couldn't make it into the final film. So I think some of those decisions were really tough when some really nice elements had to go. I think what was great was that as we were developing this, how the film would look, and you know, we were going to have a lot more original footage in at one point, and then as more animation crept in, and I kept, every time Aristea and I met, I went, right, I've illustrated this bit as well. And he was like, okay, and just more and more illustration came into it. But I think it, you know, I mean, I'm not sure about you, Aristea, but I think when it's a very different film than I had envisaged at the start in terms of how it would look. I didn't think it was going to be as illustrated in this way as it is, but I think it's a great film for it, I think.
Yeah, I think the animation, that it became an animation film more than we had anticipated. I think it was more live footage that we thought would be out there, combined with infographics and data visualization of other forms. I think in many cases the animation perhaps took, you know, the front role and the leading role in many cases. Yeah.
Yeah, I think so, and I think there are. I mean, just watching it back there, there was. I think one of the things that I've learned, and you asked me earlier about what I've learned, and I think another lesson I've learned very much is that you don't always have to show, in order to get data across, you don't have to necessarily show the numbers on the screen. You can show it by just how it feels. And there's one part of the film where we talk about the reduction in traffic. And whilst there aren't any, I think there's a statistic this I think is reduced by 73%. At that point on the screen, there are lots of fish, and then 70% of the fish disappear. Now that's not clear, it's not flagged up, but it was just a feeling that things got quieter. And it was moments like that where I thought it was really nice to just almost not do a big blaring pie chart or a bar chart, just almost to use the illustration and use the graphics to just create a feeling, which can be as powerful as a set of data. You know, I thought that was a really interesting thing to explore, and it's definitely something I'm going to try and do more of in the future. This more, I guess, more human data visualization, more human ways of conveying these numbers, because it can become quite impersonal at times, but this project certainly not impersonal.
That was the idea, to bring the humanity in it, and to bring a sense that it's not the clean version of data visualization and, you know, the public health communication that is very clean and very neat, and to bring a little bit of the messiness. Felice, hi Felice, lovely to see you here. Thank you for coming. And Felice says, will you work together again? I hope so.
I hope so.
If there is more funding coming my way, as the project reaches its end at the end of the month, hopefully there will be a continuation. But if there is a continuation, there is scope to create more informative content in the form of videos and animations for the Our Data Health project. So fingers crossed. What did you each learn about each other's ways of knowing? Do you want to start, Caroline?
Oh, crikey, this is an interesting one. It was interesting because obviously because of COVID, you and I have never actually met. We've met online, but we've never actually met because this project started during the first lockdown. So all our sort of collaboration has been done via email and sort of regular meetings. So I would say it wasn't a traditional collaboration in that we weren't sitting shoulder to shoulder deciding on shots or so I think there's probably been quite a lot of almost working independently on our various sides. So you worked on the script obviously independently and the ideas and the initial concept. I would then disappear off and do a lot of scribbles and then come back. So I think there was very much we'd go off and do our own thing and then touch base and then go off again. So I think it would be interesting, I think, for if there was another project to one, meet up and have a coffee, because we have never done that, so that would be really nice, but also to maybe, you know, sit in a room next to each other with a big sheet of paper and just thrash out ideas and creative process that way, because I think doing a lot of things online, and we've all got better at this, but I still think there are limitations with how collaboration can work in a project like this when you're doing it down a telephone or across a screen. So I think it would be nice to actually know more about how you work, Aristea, and just in terms of thrashing out your ideas, because it was very much the decisions were made apart and then we'd come together and thrash it out. I don't know if that's you know, it'd be interesting to work closer with you on another project, I think, more
Felice says the context makes it interesting. Yes, and I think for me, working with Caroline, I learned how to simplify my thinking, perhaps because perhaps as a social scientist, as an academic, we use lots of words and we use lots of difficult words to actually communicate very simple things. And I think working with Caroline helped me to simplify my way of thinking and simplify the message in a way that is more straightforward, because I think Caroline's way of working, also for the scrollable data story, has been very clean, in the sense that because you have also a journalist background, a journalism background, the way that you worked with the data for me, and to kind of to extract the key gist, the gist of the data in each case, I think was quite impressive to observe. And I think I learned a lot from that. I learned a lot from the way that you worked to, you know, highlight, use bubbles to highlight exactly, you know, what the important point was for each, you know, body of statistics, for example. So I think I did learn a lot in this process from both these collaborations about how to work with data in a way that you wouldn't. I haven't learned from, you know, brushing up my data science skills, or from you know, working more as an academic in this project. So yeah.
No, thank you so much. It was so interesting to watch and to listen to you both. And I was just thinking about whether the participants whose voices we heard How much did they understand about the overall project that you were trying to put together?
Very good question. So I think I don't see any of the participants here. Maybe there is someone, but I wouldn't recognize them because I never came in direct contact with the participants. It was always mediated. So the participants, we did follow a very university strict guidelines about consent. So they knew the idea that it was going to be a research film, a short animation film that combined public health data with the live testimonies. But at the time of the filming, the scrollable data story hadn't been produced yet, because we did that for the Brighton Fringe and we launched it in October. So when the filming was going on in August, we didn't even have something to show them if they were interested. So the participants didn't know exactly what the format of the film would be. So I would definitely love to hear from participants to see how it feels for them to watch themselves and to hear the voices in this film. There is a plan to screen this publicly when we are allowed to at the Wellsbourne. So hopefully,
That'd be good.
Yeah.
Thank you. No, that sounds great. That's just always so good to get feedback from where you can, isn't it, from participants? And I'm sure you want to do that. It'll be great when we can all get out and mix again.
Absolutely. Yeah.
Thanks both. Thank you.
Okay, let me see. There's another question. Very informative session film. Thank you, Megan and Marcus.
I think one of the interesting points, just from what Fliss said then, was that the whole title of the film came from one of the participants. So that quote right at the end, where one of the ladies says, "Human Planet Week or Other." I remember you and I were listening to this, and you said, this could almost be the title of the film, and I said, let's just go with it, and if like with titles of films, they can change over the course of a project, but that one stuck. And I think especially the way it's said just was so powerful. I think it was a really nice way of capturing everything.
Really powerful. It was very moving. Yeah. Right. Okay, I think we should end here since we've completed our hour. I want to thank everybody for joining. Thank you, Caroline, for the interesting discussion, and thank you all for your interesting comments and questions. And please feel free to send an email or anything else on Twitter or on the project email.